Well, as challenges and changes in healthcare go on throughout the country, here in the Northland there are major investments in our healthcare facilities. St. Luke's has not only committed to an entirely new $250 million campus, they also have a new leader. Joining us now is Kevin Nokels, the healthcare system's new president and chief executive officer. Kevin, first of all, welcome to the program tonight and welcome to Duluth.
Thank you.
Big changes for both Essentia and St. Luke's. What does all this mean for St. Luke's Medical Center?
You know, for I would say more for the community and the region as a whole. This is a redevelopment of the campus. Certainly through the years that the buildings have been built, things have changed, technology has changed, and so we need to change our facilities to prepare for not only what is going on today, but for the future, as well as more and more healthcare services move to a outpatient, same-day delivery.
You've been on the job a couple of weeks now. If you could just share a little bit of information about your background and what your first impressions are so far.
Yes, this is my third week and it's learning a lot. I've been in healthcare leadership for more than 30 years, started in St. Cloud, Minnesota, the last 27 years in Omaha, Nebraska, where I most recently led Creighton University Medical Center Bergen-Mercy, which was a large academic medical center, level 1 trauma center. Have spent a lot of time doing planning, strategy, government relations. So I think that has prepared me very well for this leadership opportunity. And in coming to Duluth, my wife and I, we absolutely love this region, having spent many, many trips up in the Boundary Waters through the years and here in the Twin Port regions on our vacation. So it's great to be here.
Kevin, you're a Minnesota native. How does your home state stand up and compare with maybe states that have a larger population? How does this state compare healthcare-wise?
I think Minnesota's always had outstanding healthcare, and here in this region, it's no exception. It's truly outstanding healthcare, and Minnesota is typically one of the leaders in the country around continuous improvement, quality improvement, safety, and healthcare.
Your opening press conference talked a lot about partnerships. What partnerships do you think need to be really nurtured along as you look at the Duluth community and how it integrates with the healthcare community?
Healthcare, and as I see it, having the opportunity to serve as the president and CEO of St. Luke's, an organization that has been around for well over 100 years, brings about the need for more partnerships. I think healthcare, we can't do it on our own. And you have to partner, whether it's with faith communities, other community-based services. It's partnering with your law enforcement, with fire department, your first responders. We're truly all in this together. And I believe that the opportunities are there to have more partnerships, things that we may not have thought of yet. And so, using one example around mental health, that's one, it's a great need, doesn't matter what part of the country you're in. And I think here we have that opportunity to say, how do we partner? How do we improve things, working with the schools, certainly with our first responders. So that's what I'll be looking for. Where do we have opportunities to partner with others?
What about partnerships between St. Luke's and Essentia? Right now there's $1 billion+ worth of projects planned within the healthcare community. Are there benefits to having two growth-minded healthcare campuses in a community like this where you can do some sharing as well as competing?
I believe there is. I think the community benefits, this entire region benefits tremendously where you do have choice. And however, though, while you may compete, I also believe there's great opportunities, and I'd welcome that opportunity to have those discussions around where we might cooperate for the good of the community we serve.
Kevin, as you take the reins, is there a specific vision you have for St. Luke's?
It's very early. I'm still in the learning process. Maybe I can come visit here sometime later on.
I'd love to have you later on, too.
Healthcare, you don't pick up the newspaper, you don't turn on the television without reading something about healthcare. Healthcare in this country has gotten very expensive, and it's also very inconsistent. So how do we drive for the highest quality, make healthcare safer, and also work to reduce the cost of healthcare? I believe that as a leader of St. Luke's, I have that opportunity and that expectation from the community that we find ways in which we can constantly improve our services and also find ways to reduce the costs for the employers, for the consumers throughout this region.
What do you think has to happen to really make healthcare in our country more accessible and affordable to people?
Yeah, historically, the more healthcare providers have done, they're paid more. Versus, I would say, where we are going is doing the right thing, right time. So finding ways in which you can provide the services more efficiently, but providing the correct services. Do you need to do everything that we've always done? And that to me is the opportunity. So looking at the utilization, the services that are wrapped around it. It's, healthcare is one of the few services that people have where they truly don't know what it costs. Someone else is paying for it. And so bringing that back to the person. So you're seeing health plans change with the health savings accounts plan, high deductible health plans where we as a consumer have greater accountability for our health and our decisions that we make, and finding ways to make it more affordable and keep those costs down.
To your knowledge, will you be expanding on some of the services that perhaps you don't offer now at St. Luke's?
Certainly the first phase of the project that we're in process with, it started in 2012, which created additional specialty clinics. That is continuing now with the rebuilding of the new emergency department, which is a much larger emergency department as well that has some additional rooms that are dedicated for individuals who are suffering from mental health crisis.
Okay. And with that, Kevin, we have to leave it. Kevin Nokels, new president and CEO of St. Luke's. Thank you so much.
Thank you for having me. Glad to be here.